Hello, my name is Allison Werner, and I am the Chief Editor of Orthodontic Products. Welcome back to In the Sterilization Room with Jackie, where we talk with infection control and prevention expert Jackie Dorst about how to best protect your team amid the COVID-19 pandemic. For over 20 years, Jackie has been a consultant specializing in instrument sterilization and infection control and prevention in the dental setting. She holds degrees in microbiology and dental hygiene and has been a featured speaker at the American Dental Association and the American Association of Orthodontists. Jackie, glad to be back with you again this week.
Thank you, Allison. It has been a 4th of July weekend that we're just getting back into the office from. And you may notice a little something different about my appearance.
Yes. I quite admire that one.
Yeah. Well, we're going to be talking about masks today. And that's why I wanted to start off the interview today wearing a mask. It's a level 1 mask, but it does put a little bit of fun in PPE, doesn't it?
Yes, it does.
Yeah. So I'm going to take it off now, and we'll continue with the rest of the interview with it. You know, as I said, we just got back from the 4th of July, and we're all getting back into a normal routine with it. And there's been a lot of information about COVID-19.
Yeah, definitely, definitely. Well, let's get started. So you did mention we're back from the 4th of July. I know for me personally, I'm based in Los Angeles, and with the spikes nationwide, we're seeing some rollbacks for us personally. So in restaurant dining has ended, bars have been closed again. But, you know, looking around, what I find concerning is the fact that you do see this relaxing of social distancing among individuals. And so you see before the bars closed, you saw crowded bars, you saw the beaches that were very crowded for us. I know for me, I'm hearing of cases related to large family gatherings, which have seen an increase, especially with the holiday weekend. How is this impacting the orthodontic office?
Well, as we've listened to the reports on the infection numbers and with testing, they're progressing upward in much greater numbers. Texas, Arizona, California, Florida, all are seeing greater numbers than they've ever seen. This morning I looked, over 60,000 new infections a day now are being reported. So that's going to mean to the orthodontic practice that they're going to have more patients coming into their practice that are COVID positive. And especially with it being, young children, teenagers and all, they may not show signs or symptoms. The disease can be milder in them. And the studies have shown that there's a greater viral shedding at the very beginning of the disease. So maybe even that 2 or 3 days when patients are asymptomatic, they could come in for an orthodontic appointment and as a result be shedding virus, expose the rest of the orthodontic team if they're not practicing precautions.
Right.
And, you know, throughout our conversations, as we've been doing the In the Sterilization Room episodes, we've talked about there's a need for more data, more research, more information. And we're finally getting the results of some of that research that's out there and looking at the precautions. And when the ortho team is wearing the appropriate PPE for the procedure, say for an aerosol generating procedure, that they're using that N95 respirator, HVE suction to remove the aerosols, maybe have a HEPA filtration device in there, then they are protected. But if for some reason they get lax on the protocols that have been currently recommended, then there could be an exposure incident. So I think with the increased number of infections, the ortho team's going to see more infections in patients, and there's the potential for the ortho team members to acquire an infection. Socially, maybe their child goes to a pool party and is exposed and then has an infection. Well, the guidance from CDC says if you have a family member that's sick with COVID, then you're going to need to quarantine for that 14 days too. So it's important for the ortho team to have a plan and know what to do for when those incidences crop up. And in previous episodes, we've talked about the best practices document, the one from OSAP and DQP, that has the best practices for infection prevention during COVID-19. That's almost a playbook of what to do for infection prevention for patients, for staff members, for your protocols, with documents, templates, and it is a living document that's constantly updated. And I'm going to encourage again every office that you may be going, oh, are we doing everything that OSHA and that CDC recommend? Because that document, best practices, is comprehensive. It includes all of the information from OSHA, CDC, the American Dental Association, the American Dental Hygiene Association, and yet it's written in easy to read, everyday language in a checklist template form that the orthodontic assistants, even if they're not an infection prevention expert, they can clearly understand what they need to be doing to protect themselves in the practice and to protect their patients.
Okay. Well, let's talk a little bit about the research that has come out. There's been 2 American studies that were just published in the Proceedings of the National Academy of Sciences, and they specifically tackle the issue of airborne transmission. So this has made its way into the news in the last couple of days. How does this research information help the orthodontic team with their infection control protocols?
Yes, these documents, one of the first ones was on the COVID-19 transmission, and it identified it as an airborne disease transmission. So we'll put the link up for both of the documents for the viewers that they can look at them. And one of the takeaways for the ortho team from this was looking at what the researchers looked at, and it was the University of Texas, Caltech, University of California, San Diego, leading educational research institutions. When they looked at this, they looked at the mitigating factors for preventing COVID transmission and collected all of the data from where outbreaks had been. So they were evaluating, was it social distancing? Was it hand hygiene, wearing masks? And so they focused on the cities of Wuhan, where the disease began, Italy, that had a very high rate of infection, and New York City. And then the United States also, and looked at where those infections were increasing. And then at the time, looking at April and May of this year, because this document was just published on June 30th. So it's very recent, excellent science. And when they investigated it, they found that the key factor was, when was mask wearing implemented? When was it required? When was, and then they put it all together in a graph. And I'm going to ask you to bring up this graph with it, and you'll see on the graph that where the line is where the mask implementation was implemented, and the curve went down. You can easily see on this graph the decrease in the number of infections once mask wearing was implemented versus the dotted line that would have continued in a linear fashion had mask wearing not. And so through the data research, this is the result of all of the testing for infections that has been done. Once they analyzed the data, the one significant mitigation to prevent the infections, prevent new infections, was wearing of masks, both publicly, in social situations, when we're out shopping, in malls, going to the grocery store, and then in our orthodontic practices. So transmission, there's been a lot of talk. Remember, we've talked previously, was it heavy, wet aerosol droplets? Or could it be airborne transmission? And wearing a mask, whether it's a fabric mask or the lips mask, like I put on, prevents not so much the viruses from infecting the wearer, but preventing the wearer from spreading those virus particles as they talk, laugh, seen. And the second article investigated the viral spread from all of those activities. And it
Right.
was demonstrated how long the viral spread, anywhere from 4 to 14 minutes,
Mm-hmm.
with the viruses that could be spread in airborne droplets from just talking. So excellent research, the kind of research that we need to do to develop both public infection control and what are going to be the best infection control protocols in our orthodontic practices.
Okay. So in the orthodontic office, it's very routine now to wear a mask in the clinical setting, in the reception area and everything. What about the staff room? What about when it's lunchtime? You know, how should they be more conscious of wearing the mask?
You're right, Allison. And they should be wearing a mask according to CDC recommendations, part of the ADA toolkit, and in that best practices from the moment they come in the back door until they exit the back door.
Mm-hmm.
So they don't have to wear an N95 respirator mask.
Right.
They can wear one of their cloth masks. They
Mm-hmm.
should put it on before they get out of their car to walk into the office.
Mm-hmm.
And then they're going to go into the office, go through the triage of questions. Have you had any symptoms? Take the temperature, record that on a log sheet. That's
Mm-hmm.
part of their respiratory protection plan. And then if everything is normal, no temperature spike, no symptoms with it, they put their mask back on.
Mm-hmm.
Then we've even talked about donning your scrubs at the office and your shoes so that you're not taking those germs home. So then they don their PPE, get ready for the day. Well, the orthodontic team members that are doing the aerosol generating procedures, they're going to be wearing the higher level of protection, such as the N95 respirator or a level 3 or level 2 with a full face shield.
Mm-hmm.
The other team members that are doing non-aerosol generating procedures, then they may be wearing a level 2 mask with a surgical mask with their safety glasses or
Mm-hmm.
full face shield. But at all times, all team members in the office should be wearing a mask. It's the #1 best prevention of transmission of diseases. And I think there may have gotten over the weeks that the offices have reopened, they may have gotten a little lax with, everything's okay. And I think we do need to do a refresh on what's the communication, what are we doing both for staff members
Mm-hmm.
and for the patients that are coming into the office. We can't let down our guard now because these infections are increasing. We're going to have more potentially infected patients and staff members.
Right. Well, I know that in talking with you earlier, I know that amongst you and your fellow ortho consultants, there is a concern about how doctors and staff are presenting themselves on social media and the importance of consistent messaging and the importance of wearing masks. And that gets into, how you're conducting yourself outside the practice. Can you explain a little bit about this to our audience and what they need to know?
Yeah, I would highly recommend to all the ortho teams, you're so great at being connected on social media to your patients. Be certain that when you do post photographs that everyone is wearing a mask. Or they're social distancing 6 feet apart. I've seen some really creative photographs of where they're doing the 6 feet distancing as they celebrate somebody's birthday maybe, or celebrate a work anniversary, or even celebrating getting the patient's braces off.
Right.
You can't sing one of Rosemary Bray's Devon songs and not have a mask on, because singing is going to expel those viral particles, as we saw in one of the research. So you're going to learn to sing through that mask and, congratulate patients. So when you post those photographs, make certain that you are practicing infection prevention protocols according to the correct guidance with it. And then in the social media for the team members, your personal Facebook, Instagram pages, they're connected to the office, and so we do need to be conscientious that we're both practicing proper COVID-19 infection protocol when we are out with our family, with gatherings that are allowed in your state,
Yeah.
depending on, and know what the local guidance is for
Hmm.
your state. Keep up with how many infections are in your county, and what precautions, do you need to be taking higher precautions at this time because the numbers are increasing.
Hmm.
And I think we're going to see in the next 6 to 8 weeks, schools could start reopening too.
Hmm.
And so that's going to present another challenge as the students and the teachers go back to class. There's going to be a higher exposure, potentially higher risk. Then we need to be aware of what the protective protocols are in the school system,
Yeah.
and do everything we can to mitigate that risk of infection.
Hmm. Okay. Well, again, I think this is great information for our viewers. So thank you, Jackie. We will be back next week for the next episode of In the Sterilization Room with Jackie Dorst. In the meantime, be sure to keep up with the latest orthodontic industry news or check out past episodes of In the Sterilization Room at orthodonticproductsonline.com. Until next time, take care and be safe.